Hi, I'm Mike Hitchcock. I'm a pathologist in Auckland, New Zealand, and former president of the Society, and I'm delighted to interview Jerad Gardner, Associate Professor of Pathology and Dermatology at the University of Arkansas, and he really needs no introduction. He's very familiar with the lens of a camera, with the YouTube videos and all the activities he's done. So welcome, Jerad.
Thanks, Mike.
I'd like to maybe talk a little bit more about your academic work in the pathology field, and please spill over into all the social media activity because I know it contributes so much.
Sure.
But can you? There's an interest in how senior pathologists have started their careers. Can you tell us about some key people that introduced you possibly to medicine and then to pathology? And
sure. I guess I've been interested in medicine since I was a kid. I was a nerdy, smart kid interested in science, and I always thought I wanted to be all sorts of different scientists. But it was really as a teenager, I guess kind of at the point where I thought I was too cool for all that, I decided finally to give in and accept that I needed to have a life in science and probably medicine would be good. And a good friend of mine, Sherry Reed, we were like skateboarding with some friends one night, and she said, I got a job at a pathology lab. My mom's like a histotech there and the lab manager. And she said that, we need another assistant. You should come and apply. So it was that night skateboarding that I first remember hearing about the word pathology, and I went to the lab and they hired me, and I worked as a tech assistant, changing out H&E reagents and cover slipping slides, but I got to watch the pathologists do frozens and gross dissections and autopsies, and I was 17, and that was just an amazing thing for me to see, and it really piqued my interest in pathology, but even in medicine, it really solidified my desire that I really want to be a doctor. And then once I was in med school and I got a chance to learn histology and pathology, I was hooked, and then the rest is kind of history. So that's how I kind of got into medicine and pathology.
Fantastic, fantastic. Now, you're a total people person, and I would have predicted that a person like yourself might have gone into more what we call clinical medicine.
Right.
But you've segued that so much by being more connected with the patients. How, did it surprise you to go into pathology with your?
Well, it didn't surprise me so much. I think because I didn't really know it wasn't like I had a good perception of what pathology was before to know that there was a stereotype that pathologists just, are introverts and look at their shoes and don't talk to other people, all that rubbish that people say. And there are some introverted pathologists, and that's totally fine. But I know a lot of extroverted people that are pathologists too. All sorts of people can be. But yeah, I heard that a lot in med school. Oh, you're such a people person, you can't be a pathologist, but I like pathology. So I decided to do it, and I didn't care what anyone said. And I've heard that story from countless trainees that they were discouraged from going into pathology because they were too extroverted, they're too good with people. But as you know, I talk to people all day long. You talk to people. I talk to my derm colleagues. I talk to my lab crew that makes the slides happen. Some days I look at my cell phone and I've made 25 calls that day just trying to track down different clinical pieces. So you have to have communication and people skills to be good at any part of medicine, especially pathology, because what we say is so important. It's so crucial, right? The patient gets treated based on the way we communicate. But in my practice, I found that I get to interact with people in all those ways, but I've also occasionally interacted with patients, which is a little unconventional for a pathologist to do. Just the other day, actually, I went and met with a young patient who had a rare sarcoma, and her mom. They wanted to see the pathology slides. So I actually took them a little glass recut to give to her to take home, and she was real excited about that, to have a piece of her own tumor. And then I showed them digital slides and discussed how we made the diagnosis. And it was really cool for them, I think, and empowering to be able to see and understand their disease. And then for me, it was really meaningful because it just reminds you that on the other side of that piece of glass is a real living person, and what we do is so crucially important to them. So yeah, I've had a lot of chances to interact with people, and of course I volunteer in Facebook patient groups, and I get to interact with patients, not my patients, but patients from all over the world, and talk to them about their pathology report or what margins mean, what's a frozen section or Mohs, and I get to have those conversations every day. So I have no lack of interacting with people in my career.
Yeah, exactly. Let's say the older pathologist, the pathologist less familiar with social media, what are the anxieties that they express to you about copying your style in that regard?
Well, I think I've heard not only from pathologists who are of a different generation than me, but pathologists of all ages. I think doctors are risk averse, right? In general, we're worried about getting sued, we're worried about getting in trouble, about having problems like that. And I think that's one worry is there legal risk to me if I'm talking to people or giving advice. So I never give official advice. I just tell people this is some general information. Talk about this with your own doctors. And for me, I'm interacting with patients who've already been diagnosed with cancer. So I feel like the risk of telling those people, here's some questions to ask your doctor, and here's what your report means, that seems awfully low risk to me. And in fact, I wrote a paper last year with Tim Allen, who's a pathologist who's also a lawyer. He's an MD, JD, and we published that in Archives of Pathology about not only the ethical, but the legal aspects of using social media. And we couldn't find anything in the English language case law of an example of a pathologist or really any doctor getting in trouble legally as long as they were not, as long as they were sharing only de-identified information and were, being respectful. So really, I think the risk is very low if you just use a little bit of common sense. And I think the other concern I hear is that people are afraid, well, I'm too old to learn this. First of all, that's rubbish, right? I mean, we're all smart people, right? And we're doctors. I figure if you can learn how to do heme path, right, or diagnose melanocytic lesions, you can surely learn how to tweet and use Facebook or whatever. Teenagers do that. No offense, teenagers, you're smart too. But the point is that a lot of doctors, I think, use that as an excuse. And I tell them, find a different excuse, but not that one. And Philip McKee is, I think, the greatest example. He's retired and is a good bit older than me, and he uses Facebook all the time now to teach people from all over the world through his Facebook group. So we wrote a paper together about social media for pathologists of all ages. Age is not an excuse. Anyone can use it. I think the concern is that, for people that grow up with screens and the internet, like my kids, they're going to never know a world without social media. When they see my computer, they try to touch it because they think everything should be a touch screen. Mm-hmm. They don't understand this because they're digital natives. They have grown up in a world that's digital. I'm a digital immigrant, just like you, and everyone from my generation and older. I went to a library when I was a kid, right? I didn't have Wikipedia. I didn't have a cell phone until I was an adult, and I didn't have a smartphone until I was basically almost in practice. So I had to learn all this stuff as an adult. And I feel like if you didn't grow up with it doesn't matter if you learn it at 20 or at 50 or at 70. It's still a new thing that's a little hard to learn, but we can learn stuff. We just have to push forward and try.
Yep, good. Now, sort of changing tack, your academic area is predominantly in soft tissue. That's the one that you get delight from. What led you into that? And
So I do derm path and soft tissue, and actually I probably see a lot more derm path than soft tissue cases just because derm path is so abundant. But I really have a passion for soft tissue tumors, and I think I first got interested in that in residency. Two of my mentors, Alberto Ayala and Jay Rowe at Houston Methodist Hospital, they do a lot of different parts of pathology, but they had kind of an interest in soft tissue tumors. And we would see them often, and they would show them to me, and I really thought it was fascinating because they're so rare and so bizarre and weird and different from other types of human cancer. And so that got me interested, and then I thought I might want to go and do a rotation, and Dr. Ayala set me up with Dr. Sharon Weiss at Emory, and I spent a month with her, and I was just like starstruck for one thing, and also amazed to see the numerous cases of various diseases and soft tissue pathology that she got. And it's also really amazing because these are rare tumors, and so it's hard to ever get really good at them unless you train with someone who knows about them and see a lot of them. So there's a difficulty sometimes in deciding, is this cancer or not? And a lot rides on it for the patient. So I feel it's very satisfying because it's one of those times where you can say, oh, the original pathologist is worried about sarcoma, but it's actually just nodular fasciitis. You don't even need to do more surgery. Everything's fine. And those are really great days, I think, when you get a chance to solve those cases and put the patient's mind at ease. So I think it's fascinating for a variety of reasons, and it's kind of an evolving area as we do more molecular testing and find all these new variants. And so that's kind of how I got interested in that.
So the early editions of Enzinger and Weiss were small, and now they're massive.
They are massive.
Is that largely molecular that is expanding, or new entities that are being divided off, or how this explosion, as in every topic? Really?
Right. That's a good question. I guess it's a mixture of, I think molecular plays a role, and I think also things that early on were just noticed, and we said, oh, this is a variant, and then more and more people publish, giving us a better understanding of how these things behave, what variations and features can be seen. I think, to me, a lot of the the nuance is that you see the classic example of something, and then there's all these different, oh, that one can have more cartilage or more calcifications, or sometimes this is negative for whatever immunostain it's supposed to be positive for. And I think that's a lot of the difficulty, right? All these nuanced little variations. But I think molecular plays a big role in that. And going forward, I think it will play an ever increasing role as we start doing more and more next-gen sequencing and finding all these weird fusions that no one was even looking for previously.
Yep, great. Now, one of the interesting aspects of these sort of talks is guidance for the young pathologists. We're spoiled by fabulous institutions like USCAP for pathology and the American Society of Derm Path. For a younger pathologist sort of deciding which direction to go, there's just a wealth of opportunities. You've been involved with each of the societies. How would you compare and contrast the experiences?
Well, that is, like you said, there's a wealth of great societies, which I like. I've been involved pretty heavily in the College of American Pathologists and USCAP, the United States and Canadian Academy of Pathology. They're both wonderful organizations that have played a huge role in my development and my ability to get to know people who have helped me, who have mentored me. And then the American Society of Derm Path, I think, is really special to me because it's a little smaller and it's focused on dermatopathology. And what I love about coming here to these meetings is you have access to the very upper echelon people in the field, and everyone's very welcoming. You can go up to like any person, any expert, and say, oh, hi, Dr. So-and-so, I love your book. And they'll say, oh, great, good to meet you. And they're just instantly friendly and nice. You can go introduce yourself to the president of the organization. And I think that's really cool. And it's a small enough meeting where you can feel kind of comfortable to do that. So I feel like this is a wonderful place for trainees who want to pursue a career in derm path. To come here and really get networked, because I don't think I realized it as much when I was in training, but looking back now, I recognize ever more how important my mentors were to me, not just in teaching me pathology, but in really connecting me and kind of sponsoring me and putting in a good word on my behalf that helped open doors for me. And that really put me in the position that my career has excelled the way that it has. So I feel very driven now to kind of pay that forward to the next generation. I think Tom Helm said at the President's Banquet a few years ago that you can never repay your mentors, you can only pay them forward. And that resonates so deeply with me. And I feel like this whole organization is a bunch of people repaying their mentors by paying that forward. And that's just beautiful. I love it.
Now, as sort of looking for the secret sauce, receiving many applicants for a fellowship program, as all the fellowship programs do, it's kind of overwhelming to filter out the people. Do you think you can predict who's going to be a successful and engaged fellow versus a person who maybe doesn't find that it's quite such a good fit once they're there? Well,
I'll say that, yes, I have been. So far, I can't find any wood to knock on, but 100% successful, because every fellow that I've had we're on our 8th fellow now, since I've been in practice a little over 7 years, and every fellow I've had has been wonderful. So former fellows, I love you guys, you're awesome. And I'm not lying, they're all really good. But I keep getting worried, like, what if I pick wrong one year? And thankfully, I'm surrounded by a team of other people that help me, and it's not purely my choice. But yeah, I don't know that it's so much that I'm good at picking as it is that we just have this overwhelming number of really amazing applicants, right? And one of the challenges, like you said, it's overwhelming to go through all these people who have CVs way better than mine was when I was a resident and applying, and to figure out how on earth are we going to pick one of these great people. So, and I have one spot in my program, and I'm always like, oh, I wish I had 5 spots, and I'd take all of you and say no to no one. So I try to go out of my way, actually, when I do select a fellow, to the other people we've interviewed, to say, hey, if I can make a phone call for you or help plug you in, just let me know what I can do, because I just want to see all these great applicants get into a fellowship and have a happy, satisfying career like I've had.
Fantastic. Yeah, great. Well, look, Jerad, that's a great insight into your background and some great tips for the younger people. So thank you very much for coming along here this morning in San Diego, and tremendous to have you.
Thank you.